Good evening, everyone, and welcome to today's wonderful evening with Dr. Murali Bharadwaj. Another 5 more days, another 5 more days are all that we have. No problem. Always remember PYQs, previous year questions, are going to be the last minute rescue point. We start our preparation with PYQs, we end our preparation with PYQs. In the middle, we strengthen our concepts, take the mock tests, get the right study material in hand, and go for the exam. Kaushik Adhikari, Rajesh Raj, Pooja, and many more who are all online. Please inform all your friends that Sprint 10, 1000 PYQs, each PYQ is being converted into a single liner. The topic from which it has come, which year it has come, is being tabulated. There's no miracle, tabulated. And the job of the teacher is to expose you for a random revision of all these PYQs as single liners, which is going to add a lot. It's going to increase your performance in the actual NEETPG if you are able to solve the 10,000 PYQs from 2012 NEETPG to 2023 NEETPG. I can promise you, you're going to be the winner. So already we finished Sprint 7, 8, 9. Now we are with 10. Still 11, 12, 13, 14, 15, 16 are left. 6 more sprints are there. Tomorrow, day after tomorrow, I'll give you all the sprints and all the 10,000 PYQs. Just go to the learnograph.com and download these PYQs PDFs. Thank you, Kaushik Adhikari, for the feedback. Very relaxing, sir. Keeping anxiety down are your classes. Thank you so much for the compliment. Yes. For me also, how to make you to do the revision. There is an internal anxiety which is coming down with the help of these sprint sessions. So let's make the great beginning. I hope all of you are having the PDF downloaded from the learnograph.com, Sprint 10. So let's make the great start. So we have, once you download the PDF, you get the list of the topics that came. Mainly NEETPG 2015 question bank. So NEETPG 2012, 13, 14, 15 used to have 1,000, 2,000 questions in the exam. So let's make the great beginning. Please give me a quick feedback. Are you able to see the screen, doctor? Is it visible to all of you? Yes, very good. Hypercalcemia in sarcoidosis. It is because of the granuloma in sarcoidosis, which is a non-caseating granuloma. The macrophages inside it will produce 125 dihydroxy vitamin D is what you need to remember. The embryo gets implanted in which stage? In blastocyst stage. What structures pass behind the inguinal ligament? Femoral branch of genitofemoral nerve, femoral vein, and psoas major. Superficial inguinal ring is a defect in external oblique aponeurosis. Lymphatics of the ovary go to which lymph nodes, doctor? They go to the para-aortic lymph nodes. Primary maltoma, mucosa associated lymphoid tissueoma, typically is associated with H. pylori infection. So everything, anything about H. pylori, maltoma. These two are the buzzwords in the examiner's question bank. NEETPG 2015, 16, every exam, there is a huge repetition. The nail bed of the index finger is supplied by the median nerve. Median nerve. What are the common causes of the median nerve palsy, doctor? Carpal tunnel syndrome and the lunate bone dislocation. So, radial nerve, median nerve, ulnar nerve, musculocutaneous nerve, axillary nerve. Without this, there is no question paper. Definitely one question comes from the brachial plexus. Hebra nose is caused by the Frisch bacillus. Saddle nose deformity is a feature in tertiary syphilis. Whenever obturator nerve injury is there, what is the function of obturator? Obturator nerve supply the adductors of the hip joint, and there will be pain in the hip and the knee joint. What is the effect of 2,3-DPG on the oxygen dissociation curve? So every NEETPG, there is a question on oxygen dissociation curve, which you need to be very good with. So 2,3-DPG in the RBCs, it facilitates the release of the oxygen. So hemoglobin will be given a choice. 2,3-DPG is one girlfriend, oxygen is another girlfriend. If you want me, she needs to be out. So 2,3-DPG, once it binds to the RBC is released from the hemoglobin. So why the fetal hemoglobin has a very high affinity for oxygen? It won't release it. It will only hold oxygen because fetal hemoglobin has no receptors or affinity for binding to 2,3-DPG is what you need to basically remember. Very nice to see 13 online classmates. Please inform all your friends in the various social media groups about the sprint 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. Totally 10 sprint books, each containing 1,000 MCQs converted into single liners, along with the topic classification, will give you a bird's eye view about what the examiner is going to ask in the tomorrow's NEETPG. So, Pooja is saying, trying very hard to complete the sprint, sir. Thanks to you. All the sprint ebooks are like hydrocortisone injection. Entrance exam is an anaphylactic shock. So for you to survive, you require something that will rescue you, like a steroid to bring back the life, like a norepinephrine whenever there is any shock. So that's the reason, always start your preparation. What I'm trying to tell you is, last moment anyway is last moment. Last moment mein kaise hona our attitude? Whatever possible, let me try my best. Oh God, give me time to finish this 10,000 PYQs and go to the exam. Whatever be your level of preparation. If you have not yet prepared so well, right? So, Pooja is asking, sir, can you explain oxygen hemoglobin dissociation curve? Very simple, shift to right, shift to left. It is a curve between the partial pressure of the oxygen, partial pressure of the oxygen, and what is the percentage is being saturated. So, suppose if there is acidosis. In acidosis, what do you want hemoglobin to do? You want it to release the oxygen, right? So there is a reason acidosis will push the hemoglobin to release the oxygen. So what are the four factors that shift the ODC to right and to left? You need to make a quick note and remember, because one MCQ invariably comes in every exam, which you need to remember. So, doctor, so the whole idea of the sprint PYQs is to give you a quick bird's view, what you need to revise in the last moment. जितना रिवाइज कर सके, जो रिपीटिंग टॉपिक्स हैं उसका रिवाइज करो, बाकी चीजें भगवान के हाथ में छोड़ दो, राइट? Olfactory nerve is a pure sensory nerve. Just like facial nerve is it sensory? It has got a tympani. Oculomotor, trochlear, etc., which is sensory, which is mixed nerve, which is pure motor nerve, you need to be sure. Just like trochlear nerve is a, abducens is a, pure motor nerves is what you need to remember. Now, good. Now, doctor, Staphylococcus aureus is the most common cause of osteomyelitis. Whenever most common cause का क्वेश्चन आ गया तो इन्फेक्शंस में अगर स्टैफ ऑरियस है तो स्टैफ ऑरियस ही आंसर होगा, टीबी है तो टीबी ही आंसर होगा, दोनों कभी भी एग्जामिनर नहीं मिला के देगा, राइट? नाउ CEA increases in non-neoplastic conditions like hemolytic anemia and pancreatitis. Follicular carcinoma में what is the translocation that you see? PAX8 and PPAR gamma translocation is a feature of follicular carcinoma. So every time papillary carcinoma, anaplastic carcinoma, follicular carcinoma, invariably medullary carcinoma of the thyroid, one question on the thyroid carcinoma will come and you have to be ready to face it, doctor. Right? Now, external auditory canal typically is formed from the first branchial groove. All the branchial arches, what are their nerves, what are the muscles derived, you need to be very sure. The number of stem villi at the term in human placenta is 60. Human placenta is a discoid hemochorial deciduate placenta is what you should remember. A mature placenta has 150 ml of the blood in the villus system, 350 ml in the intravillus system. You need to be very sure. What is the female analog of the prostate gland, doctor? Skin gland. Quadrangular space, what are the boundaries? What are the contents? You need to be sure. Triangular space, quadrangular space. So just make always a note because this question came in the NEETPG 2015 और एक बार आने का संभावना है. Axillary nerve passes through the quadrangular space. From where these lumbricals originate. They originate from the tendon of flexor digitorum profundus. What is the function of lumbrical, doctor? Lumbrical, remember, always lumbrical. How do you remember? You can remember, this is L shape, right? L. What is this? Interphalangeal joint. And what is this? Metacarpophalangeal joint. Extension at interphalangeal joint and flexion at the metacarpophalangeal joint. Interphalangeal is extension, metacarpophalangeal is flexion, is the classical nature of action of lumbricals is what you need to remember. Once more, dorsal and palmar interossei. All of them are supplied by the ulnar nerve. So, doctor, pronator teres is used as a substitute whenever the extensors of the wrist are paralyzed in radial nerve palsy. Any radial nerve injury in the spinal groove, Spiral groove is in the lower one-third of the humerus. Radial groove it is called. So, any fracture of the lower one-third and middle one-third junction में अगर fracture हो गया तो radial groove is affected and there will be wrist drop. Cervical spine is most commonly affected in rheumatoid arthritis. Between anterior posterior dislocation of the shoulder, what is more common? Anterior dislocation. Only in the patients who have epilepsy or whenever there is any electroconvulsive shock, only in such people there will be posterior dislocation of shoulder. Hamilton-Ruller's test is seen in malunited lateral condylar fracture of the humerus. Greater cerebral vein of the Galen drains into straight sinus. It is the myosin phosphorylation which is essential for smooth muscle contraction. So what is the resting membrane potential of the smooth muscles, skeletal muscles, naru? You need to be very sure. Smooth muscle is minus 40 millivolts. Spermatogenesis begin at puberty. So you need to be very sure as to luteinizing hormone, follicle stimulating hormone, Leydig cells, Sertoli cells, spermatogenesis. What are the primary spermatocytes, which are haploid, which are diploid, what are spermatids, everything about spermatogenesis you need to go back and do a quick revision. How is tongue supplied? Lingual nerve is the motor supply. Even the vagus nerve, glossopharyngeal nerve, these three nerves supply the tongue. The primary complex of Mycobacterium bovis typically involve the tonsil and also the intestine is what you need to remember. What constitutes the anterior tonsillar pillar, doctor? Palatoglossal fold is the one which constitutes. The floor of the Petit's triangle is formed by internal oblique. Once more, what are the boundaries of Petit's triangle? How is the floor formed? Everything you should be sure because it came up in NEETPG 2015. So once more, doctor, I have pasted below the link www.learnograph.com. अगर आप गए तो आपको ए स्प्रिंट पीडीएफ्स मिल जाएगा. Sprint 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. 10 PDFs. Do the revision of 10,000 PYQs as a single liner. They are being converted and which topic they belong to, they are being classified and made available in the PDF, which will give you a bird's eye view about what examiner is going to ask. Ultimately, anything above this 10,000 PYQs is an extra layer for you. But these 10,000 PYQs are a minimum guarantee that you need to promise yourself when you are going for the exam. Now, largest cranial nerve is the trigeminal nerve. So once more, superficial perineal space, deep perineal space, what do they contain? What are their boundaries? Everything you should know. Superficial perineal space contains ischio-cavernous muscle. Extraperitoneal, intraperitoneal bladder of the rupture. Bladder rupture, one of the favorite questions. So membranous urethral injury lead to extraperitoneal bladder rupture. Red keratic precipitates. Different types of keratic precipitates you should know. Granulomatous uveitis lead to development of mutton fat keratic precipitates. Red keratic precipitates are seen in hemorrhagic uveitis is what you need to basically remember. So Hemant is asking, can we read it for FMGE, sir? Definitely, FMGE, NICET, NEETPG. All of them, the national testing NTA is the one which is in control. So that is the reason a lot of commonness. After the NEETPG exam is over, I'm going to give you 15,000 single liners of the FMGE question bank of the past 15 years of question bank. Every year, ultimately, the 200, 300 questions come only from this question bank. But how you master it is important. So, first you have it like a single liner and what is the topic under which they are being classified. Half the game is over, right? And after the FMGE exam is over, I'm going to launch 10,000 PYQs of the INI CET as around 10 sprint ebooks. So that's how it will help you to consolidate and conceptualize your preparation. आप कहीं भी coaching को जाओ, कोई भी video भी देखो, ultimately what it boils down is to the PYQs. So that is the reason a lot of times we will have a lethargy. भाई हम एक MCQ book खरीदेंगे PYQs का, वो एक एक क्वेश्चन को बड़ा बड़ा एक्सप्लेनेशन मिलता है, सॉल्व करेंगे, नहीं होता वो. Unless you condense all these PYQs into single liners and made it available comprehensively along with what topics you need to master and fathom deep, especially when they are frequently appearing, right? So every 1 hour you can review 100 PYQs. In 10 hours, 1000 PYQs first time. And in 100 hours, you can finish 10,000 PYQs. कभी भी आप preparation शुरू करें तो first 100 hours should be spent on quickly going through sprint 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. These 16 books of 10,000, these 10 books, sprint 7 to sprint 20, sprint 16, these 10 PYQ ebooks, PDFs, download from learnograph.com. All your approach should be in the first 100 hours to know what examiner want. At 10,000 may, at least 5 to 6,000 you have never read in MBBS, but still you passed the exam. कोई बात नहीं. पहले बार सुन रहे हैं हम ऑक्सीजन डिसोसिएशन करो क्या है, और राइट शिफ्ट क्या है, लेफ्ट शिफ्ट क्या है, तो क्या है. अभी हम जाएंगे और पढ़ेंगे. कोई नहीं बोला कैसे पढ़ना. Renal tubular acidosis, type 1, type 2, Bartter syndrome, Liddle syndrome, monoclonal antibody का list, carcinoma cervix staging, breast carcinoma staging. First time you might have read, doesn't matter. But frequently it is coming in the exam. Imatinib क्या है मालूम नहीं, CLL क्या है मालूम नहीं, what are the good and bad prognostic factors of the ALL भी मालूम नहीं. कोई बात नहीं. First 100 hours should be to know what is the pitch. Just like Rohit Sharma or anybody, first initially few balls they will know, they will warm up. Then you take about 150 to 200 hours to revise all the high yield topics. Once more, last 100 hours, you once more do 1 or 2 revisions of the PYQs. And there are 50 full-scale grand tests. Just do the revision of them. They are also available on the learnograph.com. More than enough. And every day I will be coming online to spend 1 hour of my time to you across the year. What more you need? Don't need any special coaching or anything. Have 2-3 friends who are preparing for the exam. That's all. So Hemant, you can very much use these PYQs. Just now, about a group of 8 students have downloaded the Sprint 10 ebook from the Learnogram, and I'm sure it helps their preparation very much. Now, doctor, esophagus V, before that, Brody-Strandlenberg's test is typically positive whenever there is a varicose veins and femoral incompetence. Of course, today who is doing Brody's Trendelenburg test? Everybody is focusing on ultrasound to make out the diagnosis, Doppler to make out the diagnosis. As Azygous vein drains into superior vena cava, the right supravenal vein drains directly into the inferior vena cava, whereas the left suprarenal vein drains into left renal vein and then into the inferior vena cava. That's the reason whenever there is any renal cell carcinoma, the left side tympaniform plexus, everything drainage get affected. That's the reason any rapidly developing varicocele on the left side should make you to suspect the possibility of renal cell carcinoma. Upper limb deformity in Ehrlich's palsy, the typical Porter tip position. Why do you get that? Adduction and medial rotation of the arm is responsible. What is Ehrlich's palsy? Ehrlich's is upper brachial plexus, C5 and C6. C7, C8, T1 is all clunky. Once for all the differences you should know. What is the root value of thoracodorsal nerve? C6, C7, C8. Teres minor, what is the nerve supply? Axillary nerve. Axillary nerve also supplies deltoid. Levator scapulae, where does it insert into the superior part of the medial scapula border? Breast mein kitne lobes hai, doctor? 15 lobes, exactly 15 students are attending live online right now. Breast contain 15 lobes, please try to remember. The long head of the triceps, it arises from the infraglenoid tubercle. The medial boundary of the cubital fossa is formed by pronator teres. Lateral boundary of the cubital fossa is formed by brachioradialis. So what is the function of biceps brachii, doctor? Biceps brachii flexes the elbow. All of us know that. But you do supination. Very important question this is. Very, very important question. Supination बोले तो soup पीने के position में palm looking to the roof. Palm looking to the roof is supination. Press, whenever the palm is looking down, you call pronation. अगर आप supination कर रहे तो you hold your biceps. Biceps is becoming contracted. You flex the elbow and do the supination. Your biceps is contracting. So whenever elbow is in flexion and you are doing supination, then what is the main supinator? It is the biceps brachii. But if you extend your elbow and you are doing supination, your biceps has no contribution. That time it is the supinator muscle of your forearm is causing the supination. So that is the reason you need to be very sure. The supinator in the forearm, which is the main supinator, when the elbow is extended, is supplied by radial nerve. Whereas the biceps brachii, which is the main supinator, when your elbow is flexed, that time supination is because of the biceps brachii, which is supplied by musculocutaneous nerve, is what you need to remember. So whenever a patient has a lower part of the humerus fracture and the radial nerve got injured, then he has a difficulty to supinate when the elbow is extended because it is the supinator muscle in the forearm responsible. Whereas he has no problem to supinate, even if radial nerve palsy is there, he has no problem to supinate when the elbow is in flexion, because that time it is the biceps brachii, which is the supinator, which is supplied by musculocutaneous nerve. This is one of the favorite questions of the examiner. So, doctor, The third extensor compartment of the wrist contains the tendon of extensor pollicis longus. So, if you look at pelvis, there is one greater sciatic foramen and a lesser sciatic foramen. You should know what are the contents of each of them. The sciatic nerve leaves the pelvis, is the nerve that leaves the pelvis. Adduction and abduction of the foot typically occur at subtalar joint. If you look at the femoral triangle, the lateral margin of the femoral triangle is formed by sartorius muscle. The most common ligament damaged in the knee injury hota hai medial collateral ligament. So you should know what is the dangerous triad of O'Donoghue. Dangerous triad of O'Donoghue. Medial meniscus, medial collateral ligament. They all get combined together. They get damaged. Called dangerous triad of O'Donoghue. Ischiorectal fossa. The lateral border is formed by obturator internus muscle. What is the largest among the adductors of the thigh, doctor? Adductor magnus. The naam hi Magnus hai. Magnus means largest, is what you need to remember. Whatever. See, kelte we finished 60 high yield facts. So in this PDF, you are having 1000 high yield facts. Right? So how much time did we take to finish this? Hardly 25 minutes. So, 1 घंटे में अगर आप कोई दोस्त के साथ बैठ गए तो 150 हाई यील्ड फैक्ट्स का एक राउंड रिवीजन मार सकते हैं. So 6 to 7 hours if you sit, you will finish this PDF of 1000 high yield facts. And let me promise you, straight from this PDF, कल के exam में, basis of this PDF and on the topics in this PDF, 30 to 40 questions जरूर आएगा, right? So those topics which are you are getting completely clean bold, no? Just you need to go back to your whatever the study material and try to do the revision. So this is the best thing I can help you in this last moment before exam. Lot of people conduct session by saying that ये strategy follow हो जाओ, elimination strategy follow हो जाओ, इतने क्वेश्चंस अटेम्प्ट करो, उतना नहीं करो, वो सब बेकार बकवास पॉइंट्स हैं. Because if you know the high yield facts, this 10,000 PYQs, automatically your eye will go and hit what is the correct answer. Simple. There is nothing, there is no shortcut for NEETPG. The shortcut is only one cut to master the PYQs. The medial cutaneous nerve of the arm is injured in the radical neck dissection, and that lead to loss of sensation in the medial side of the arm. Just stay online, I'll get some water. Now, the ossification center for the lower end of the femur is present at the time of the birth itself. What is that ligament that prevents the hyperextension of the thigh? It is the iliofemoral ligament. The lower limit, what is the surface marking for the superior mediastinum, doctor? T4. Arch of aorta begins and ends at the level of T4. आपको कुछ भी नहीं याद आए कल के नीटपीजी में आंसर करो T4. Now, the intercostal nerve is the branch of the ventral rami of the thoracic spinal nerves. Where is cricopharynx? Cricopharynx is 15 centimeters from the incisor teeth. So you should know what are the various esophageal constrictions and where are they located from the incisor tooth when you are passing the endoscope. So esophageal constrictions is a favorite MCQ in the tomorrow's NEETPG. Once more, the venous drainage of the heart and the coronary arteries. Favorite question. The great cardiac vein is found at the apex of the heart. The great cardiac vein is the tributary of the coronary sinus. What are the segments of the upper lobe of the right lung? Apical, anterior and posterior. In the left lung hilum, what are the various structures in the descending order? The pulmonary artery is the uppermost structure in the left lung hilum, is what you need to remember. Ligamentum arteriosum is derived from ductus arteriosus in the embryonic life. So all the embryonic structures and their adult derivatives, एक लिस्ट टेबल है, वो टेबल आप गर्मा गर्म पढ़ लेना. The base of the heart is formed by left atrium. You know, between right atrium, left atrium, what is more anterior? Right atrium, right ventricular, or anterior? Left atrium, left ventricular, or posterior? That's the reason whenever there is any severe mitral stenosis, whenever the left atrium got enlarged, it will go and compress the posterior mediastinal structure like esophagus and can lead to the development of dysphagia. Similarly, the enlargement of the left atrium in mitral stenosis can lead to the splaying of the trachea. Trachea is also a posterior to the heart, and left atrium is the most posterior structure in the heart. Right ventricle is the most anterior structure in the heart, is what you need to basically remember. The right border of the heart is formed by the right atrium. Base of the heart is formed by left atrium. So whenever the left atrium enlarges, how will it enlarge? It will enlarge towards the right side of the heart. So already right border is formed by right atrium. Into that the left atrium, which is enlarged, will come, and there will be two shadows, and that is called shadow within the shadow appearance. Radiologically is what you need to remember. Innomine valproate is asking, sir, which sprint has the latest PYQ, sir? So remember, sprint totally has 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. So everything starts from sprint 7, right? It started with NEETPG 2022 paper. NEETPG 2023, I will try to add it into one of the later sprints. So there is a reason the latest sprint are starting from 7 towards more remote NEETPGs that will be in the sprint 16 book. Already 7, 8, 9, 10, 11 we published online. All right. So any doubt is there, please feel free to call 9000-868-356. Right, doctor? Each sprint ebook will cost you $300. You will take 7-8 hours to master those 1000 PYQs in each sprint book. And in this last minute 5 days, 6 days, 7 days जो भी है ना, वो गणित पहले से wrong है. We should not look at life and exam preparation like last 5 days, last 7 days, last 10 years of life, last 20 years of life. Right now I am 51. So if I look at the life like last 30 years of life or last 20 years of life, it is difficult to live the last 20 years. That's the reason what you need to do. You need to try to do the best and deliver the best what you can do in this last 5 days, and that is only possible with the revision of the sprint PYQ PDFs on the learnograph.com. So, doctor, right ventricle, it has the most prominent trabeculation, crista supraventricularis, which is separating tricuspid valve from pulmonary valve. Internal anal sphincter is part of the internal circular fibers. Membranous Urethra is the shortest part of the male urethra. Once more, you should know penile urethra, bulbar urethra, membranous urethra, and what will happen in extraperitoneal and intraperitoneal rupture of the bladder. You need to be very, very sure about. So, Kaushik, Hemant, everybody keep punching whatever the points that come to your mind so that it will be like a combined study. So, we are right now at High Yield Fact 80 in the Sprint 10 ebook, which is based on the NEETPG 2015 question bank. Now, the posterior relation to the neck of the pancreas is the origin of the portal vein. Portal vein is formed by mesenteric vein and splenic vein. I think you all know that. Now, esophageal varices occur in lower part of the esophagus. Anorectal angle, which is responsible for the continence, is maintained by the puborectalis muscle. Ventral pancreatic duct gives rise to the uncinate process. The embryology of the pancreas is a favorite question. Hostrations are the classical radiological sign par excellence of the colon. So what is the anterior relation to the upper part of the rectum, Dr.? Rectovesical pouch. There is a bladder, there is a rectum. Rectum is more posterior, bladder is more anterior. Between the two, there is a rectovesical pouch. You need to be very sure about. So what is the sensory nerve supply of the gallbladder? Vagus. Uvula vesicae in the bladder is because of the median lobe of the prostate. What is the ligament that prevents the spleen from enlarging towards the left iliac fossa rather to enlarge towards the right iliac fossa? It is the phrenicocholic ligament, is what you need to remember. Labor pain in uterus is carried by the sympathetic nerves. The great saphenous vein starts as a continuation of the medial marginal vein. Gastrosplenic ligament contains short gastric artery. Lesser omentum is a derivative of ventral mesogastrium. So once more, lesser omentum, greater omentum, embryology, rotation of the gut, everything you should know. So what is the correct sequence of uterine blood flow? Uterine artery, arcuate artery, radial artery, then spiral artery. S for stapedius, S for seventh nerve, S for second arch. Stapedius is supplied by seventh nerve. What is the function of stapedius? It pulls the stapes in a posterior direction. That's the reason whenever you listen any sound, the tympanic membrane, somebody need to pull and dampen the sound. So there are two muscles, tensor tympani, stapedius. Stapedius pulls the stapes in the posterior direction, and if the seventh nerve palsy is there, stapedius is not working, then even a small sound will appear very loud in your ear. Sternocleidomastoid, how can you examine? By turning the head towards the opposite side. That means right sternocleidomastoid, by asking patient to look at the left side, is what you should remember. Where is the trapezius attached? It is attached to the superior nuchal line, and which layer of the scalp is called subaponeurotic. It is called dangerous area. It is a subaponeurotic tissue because there is nothing supporting the blood vessel. Any bleed there will be uncontrolled, profuse. Whenever you are dissecting the superficial and deep lobes of the parotid gland, which nerve will you preserve? Facial nerve. Constrictor pupillae is supplied by parasympathetic, supplied by the ciliary ganglion, innervated by oculomotor. Right? So, any oculomotor palsy can lead to especially when the cause is surgical, will lead to paralysis of the constrictor pupillae leading to mydriasis. Whereas medical causes of oculomotor palsy like diabetes, hypertension, they don't involve the parasympathetic fibers going to the constrictor pupillae. This reason, medical causes of oculomotor palsy lead to pupil sparing oculomotor palsy. Surgical causes, what are the surgical cause of the oculomotor palsy? Any aneurysm of the PYQ, posterior communicating artery, which is connecting the posterior cerebral artery and the middle cerebral artery. So posterior communicating artery aneurysm will cause the compression of the oculomotor nerve. There the constrictor pupillae are affected and there is a pupillary dilatation. Postganglionic fibers to the parotid gland are supplied by auriculotemporal nerve. Secretomotor fibers to parotid glands are through tympanic plexus. Which cranial nerve has longest intracranial course, doctor? Fourth cranial nerve. Geniculate ganglion gives rise to greater petrosal nerve. Once more, lesser petrosal nerve, greater petrosal nerve, geniculate ganglion, Gesserian ganglion, otic ganglion, ciliary ganglion, all these parasympathetic ganglia. One MCQ is going to come in the tomorrow's NEETPG exam, doctor. Third ventricle is the cavity of diencephalon. Whatever, we finished 105 MCQs from the 2015 question bank. 7 घंटे 7 hours बैठ गए तो आप स्प्रिंट ई बुक पीडीएफ आपके सामने आईपैड में रखे, एक साथी के साथ बैठ के फ्रंट एंड बैक भजन करना. Whatever you remember, you will remember. Don't worry. Whether I remember or not, don't worry. Right? Where is oculomotor nucleus? It is located in midbrain. You know, midbrain, pons medulla. Third, fourth, midbrain. 5, 6, 7, pons. 8, 9, 10, everything in medulla. You'll remember, right? Now, what is the common sensory nucleus for 3 cranial nerves? 9th, 10th and 7th. 9th, 10th, 7th. NTS. Nucleus. Tractus. NTS. Right? So, nucleus tractus solitarius is the common sensory nucleus for 9th, 10th and 7th. The nucleus ambiguous is the motor nucleus for the vagus, is what you need to remember. Now, major supply of the medial surface of the cerebral hemisphere comes from anterior cerebral artery. That's the reason you should remember. Whenever anterior cerebral artery is involved, what is the neurological deficit you get? You know that homunculus diagram in physiology textbook. Our lower limb will be dangling through the medial surface, which is supplied by anterior cerebral artery. That's the reason when the anterior cerebral artery stroke is there, contralateral lower limb monoparesis is the feature. Whereas middle cerebral artery leads to contralateral hemiplegia. Whereas anterior cerebral artery leads to contralateral lower limb monoparesis is what you need to basically remember. Ventral tegmental decussation in cerebral peduncle is because of the rubrospinal tract. Rubrospinal tract contains red nucleus. So remember, there is something called olivary nucleus in the medulla. So all our spinal cord brings information, and from the olivary nucleus through the inferior cerebellar peduncle it will go to cerebellum, and from the cerebellum to the dentate nucleus it will go to red nucleus, from the red nucleus to thalamus to the motor cortex, and once more it will come down with the pyramidal tract. It's called olivo, dentato, rubro, thalamo, cerebral pathway is what you need to remember. So red nucleus is a very important location to control our balance. It gives information coming from the cerebellum to the brain. And cerebellum receives the information from the spinal cord. And you have three cerebellar peduncles, inferior, middle and superior. So the brainstem has three structures. What are they? Medulla, pons and midbrain. Medulla through inferior cerebellar peduncle, pons through middle cerebellar peduncle, and midbrain through superior cerebellar peduncle. These three cerebellar peduncles are connected to the brainstem. If you look at the inferior and middle, they will only bring afferent to the cerebellum, whereas only superior cerebellar peduncle takes the efferent from the cerebellum and goes to the midbrain. That's what you need to remember. उससे ज़्यादा neurology, neuro-anatomy जान की खतरा है last 1 week में. So what you should remember in this last moment, don't get too obsessive that I want to master everything and go to exam. Oh, how did I use my time? Don't think. जितना आप याद रखते ट्राई करो, जितना नहीं छोड़ दो भगवान के ऊपर. But try to finish at least one martaba all the PYQs. So please don't forget learnograph.com. I leave the link below. So just go to learnograph.com, download the Sprint ebook PDFs, and then you have 10,000 PYQs as single liners for you to do cursorial last moment revision before election, right? So that should be the spirit. Now, oxyntic cells are present in the body of stomach, which is the first bone to start ossifying mandible. Incudomalleolar joint is an example of a saddle joint. So the different types of joints you need to be very sure, doctor. Hilton's law is related to nerve innervation. Once more, go back and check what is Hilton's law. Branchial cyst most commonly arises from second branchial system. By when heart tube is formed? 3 weeks. Heart tube formed in hyaluronic acid secreted by myocardium. Myelination in peripheral nervous system is by the Schwann cells. Myelination in the central nervous system is by the oligodendrocytes. And multiple sclerosis-like conditions are demyelinating because of the autoimmune destruction of the Schwann cells and oligodendrocytes. Malleus and incus are derived from the first arch. So all the branchial arch derivatives, make a list and do the revision. Sertoli cells are derived from the germinal epithelium. Pars tuberalis is a derivative of Rathke's pouch. So she looks too pretty, try to catch her. She looks too pretty, try to catch her. P catches the T. Pisiform articulates with triquetral. She looks too pretty. S for she. Scaphoid. Looks. L for lunate. Too pretty. P for pisiform. Try to catch her. Try is triquetral. Catch is capitate. Her is hamate. So you should be very sure of the carpal bones. Where do you see spleniculi? Most commonly in the hilum. Seminal colliculus, where is it present? In the urethra. For the transport across a membrane, concentration gradient is most important factor. Active transport against the concentration gradient. Active transport is not like passive transport, it is against the concentration gradient. Active transport के लिए आपको carrier होना है, it is carrier mediated, is what you have to basically remember. Very good. Just now a group of 5 students have downloaded the whole sprint PYQ series till now published from the learnograph.com. Very good. So last moment में the only thing that saves is PYQ, which is like oxygen supply. Both active transport and facilitated diffusion, both of them are carrier mediated. Through cell membranes, diffusion occurs through pores. At birth, the total body water is 80% of the body weight. Whereas when we become adults, the TBW, total body water, is 60% of the body weight. Epithelial sodium channels, which are there in the collecting duct, which are affected by your aldosterone, they are composed of 2 alpha, 1 beta, 2 gamma subunits. Intracellular versus extracellular fluid. Intracellular is less acidic than extracellular. Globulin is the one which increases the plasma viscosity maximally. Thus reason those who have heavy chain disease, multiple myeloma, they're all vulnerable to hyperviscosity syndrome. Now, albumin contributes to oncotic pressure. Motor evoked potentials. Typically, they assess the central motor pathways. Any transient response in EMG at the electrode insertion indicate cell membrane damage. So, the perception of the light, the visual cycle, is all because of the conformational change in the opsin. So, when will phosphorylation occur, dephosphorylation occur to the opsin? You need to go back and look at the visual cycle once. What is Herring-Breuer's reflex? So, all these J receptors, Herring-Breuer reflex, baroreceptors, what are the afferent, what is the efferent, everything you should revise, doctor. Bellerian degeneration is the neurodegeneration. Withdrawal reflex is also known as flexor reflex. Withdrawal reflex. Babinski is a extensor reflex. Muscle tetany occurs despite normal serum calcium level whenever there is any magnesium deficiency. Always remember, hypokalemia, hypocalcemia. Unless you correct the magnesium deficiency, they won't resolve that easily. A delta and the C fibers are the ones which carry the pain. Once more, the nerve fiber classification, which are myelinated, unmyelinated, where the conduction is very fast, very slow, everything you should be sure. SA node, why it is a pacemaker? Because it generates the action potential at the fastest rate. Pacinian, Ruffney, Meissner, all this you should be sure. Vibration is detected by Pacinian. Sustained pressure by Ruffney is what you should remember. Prosopagnosia means Anjan Marna. That is, inability to identify the faces is called prosopagnosia. Broca's area is the motor speech area in the inferior frontal gyrus, whereas the Wernicke is the one which is in the temporal lobe. So you should know differences between conduction aphasia, Broca's aphasia and Wernicke's aphasia. Brodmann's area 44 is the motor speech area. Maximum density of the muscle spindles कहाँ होता है? Lumbricals. In the flight and fight response, epinephrine and norepinephrine, they lead to increase in the blood flow to the muscle. All the EPSPs, excitatory postsynaptic potentials, are because of the sodium reflux. Very good, doctor. 150 questions we finished. कितना टाइम लगा हमको? 1 घंटा लग गया 150 खत्म करने के लिए. गब्बर पूछ रहा है कितना गोली, कितना आदमी? अरे हुजूर, पूरा 1000 आदमी है, 150 गोली खत्म हो गया. So this is how, with endurance, you need to master these 10,000 PYQs. Automatically your brain knows where is the right answer. No elimination tricks, techniques, ये है वो है, ये secret है वो secret है, all that is bakwas. What you need is, you have this 10,000 question bank in your mind to guess what is the correct answer in a multiple choice question setting. But the problem is what? The problem is what? ये सीनियर लोग हमको बोलते हैं भाई पहला आप अच्छा बेसिक्स पढ़ना है, वो वीडियो पढ़ना है, ये प्लान ये पढ़ना, प्लान बी पढ़ना, मोटा मोटा टेक्स्ट बुक्स करना, मॉक टेस्ट लेना, ये वो बोलते. ये सबके कंफ्यूजन में क्या भूल जाते हम? PYQs को भूल जाते. पूरा दुनिया की गर्लफ्रेंड्स के लिए ट्राई कर रहे, भाई मामा की बेटी वेट कर रहे आपके लिए बाइक में चढ़ने के लिए. उसको छोड़ के इनके पास उनके पास गए तो क्या फायदा है? राइट? PYQs are also like मामा का बेटा और मामा का बेटी who is waiting to marry you, but we are running behind some video libraries, some mock test series, some face-to-face classes, some कुछ crash courses, कुछ बट्टी मारो रट्टा मारो sessions and all that. All is waste. First, whenever you tell your juniors, whenever you start preparation, 100 hours you will take. 1 hour में 150 खत्म. एक दोस्त के साथ बैठो, 1 hour में 150 PYQs खस. Then 7 hours में 1000 खत्म हो जाएगा. ये 1000 में दूसरी बार देखने का लायक खाली 300-400 होता है. राइट? सो 10,000 PYQs में आपको 2-3,000 PYQs को और एक मर्तबा देखना. सो 15-20 आवर्स में आपका और एक राउंड रिवीजन हो जाता है. ये मिनिमम गारंटी होने के बाद आप कुछ भी करो दुनिया में हो जाएगा. एंड डोंट ट्राई टू सॉल्व क्वेश्चन बैंक्स ऑफ द PYQs. बकवास, वेस्ट. They're straight away simple questions. First, try to know what are the questions, right? What are the PYQs? Try to know what are the issues examiner is interested. EEG waves, examiner want to know. Breast carcinoma staging, examiner want to know. Oral concept pills, carcinoma cervix, ovarian tumors, bone tumors. Where do you see Codman's triangle? Where do you see soap bubble appearance? Where do you see nocturnal pain relieved by giving salicylates like in osteoid osteoma? Examiner कुछ स्टैंडर्ड क्वेश्चंस है, वो स्टैंडर्ड क्वेश्चंस एक मर्तबा समझ लो. राइट? सो दैट इज व्हाट यू नीड टू डू. डॉक्टर प्रकाश बादुरिया and many more who are all online and attending this session, in this last moment you are giving opportunity to me to be with you. Right, doctor? So I don't talk any strategy, I don't give any last moment tips. The only tip I tell you, still we have 4 more days left. 10,000 PYQs are available as Sprint 7, 8, 9 up to 16 series on the learnograph.com. डाउनलोड करो, नीचे मैं लिंक छोड़ दिया, और एक फ्रेंड के साथ बैठ के जितना फास्ट 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 टर्नओवर करोगे, that much improvement you are going to get in the tomorrow's NEETPG exam. I can bet it. Now, doctor, what is motor speech area? Bloodman's area 44. Sleepwalking, somnambulism, stage 3 and 4 NREM sleep. What are the only excitatory cells in cerebellar cortex? Granule cells. So you should know the different cells, what is their function in the cerebellar. Histology is a favorite area of exam. Phytates inhibit the absorption of the calcium. Now, Doll's eye reflex is used in unconscious patients to know the brainstem function. Adrenal medulla secretes the chemical transmitter, catecholamines, which is a part of the sympathetic system. Neuropraxia there is no structural damage. Once more, neurotmesis, axonotmesis, neuropraxia, you should know the difference. What is meant by Bohr's effect? A hemoglobin है ना? There is a decreased affinity of hemoglobin for oxygen associated with the decreased pH and increased carbon dioxide. Whenever you have hypercarbia or acidosis, हीमोग्लोबिन समझ लेता है भैया ऑक्सीजन नहीं है, ऑक्सीजन टिश्यूज को जरूरत है, उसको मैं पकड़ के नहीं बैठना, इसलिए there is a decreased affinity of hemoglobin for oxygen whenever there is acidosis, decreased pH or increased CO2. Haldane effect क्या होता है? It describes carbon dioxide delivery by the increased oxygen levels. Oxygen bind हुए तो CO2 deliver हो गया. Total surface area of the respiratory membrane is 100 meters square. What is transpulmonary pressure? Difference between alveolar and intrapleural pressure. So what is the normal transpulmonary pressure during quiet breathing? +8 to +5 centimeters of water is what you should remember. What is the partial pressure of the oxygen at 760 millimeters mercury of atmospheric pressure? 60 millimeters of mercury, 160 millimeters of mercury. Partial pressure of the oxygen in inspired air is 158 millimeters of mercury. What is meant by isocapnic buffering? When there is normal PCO2 and increased CO2. Can you measure vital capacity with spirometer? Yes, sir. Can you measure residual capacity? No, sir. And any lung volume where residual volume is a component, you can't measure with spirometer. Total lung volume in emphysematous bullae, how can you measure? Plethysmography. What happens to lung compliance in emphysema? It decreases. What is the normal lung compliance? 200 ml per centimeter of water. In chronic smokers, at zero relaxation pressure, what happens to the lung volume? Lung volume increases. PaCO2 indicates how well the CO2 is getting eliminated from the lung. So whenever you have emphysema, bronchitis, obstructive lung disease where CO2 cannot be purged out, that lead to hypercapnia leading to altered sensorium. At zero gravity, the PYQ ratio is equal to 1. The ventilation equal to the perfusion. What is the normal oxygen extraction ratio of the tissues? 1/4, 25%. So what is Poiseuille's law? Blood flow is inversely proportional to the 4th power of the radius of the blood vessel. When will aortic valve closure begin? At the start of the isovolumic relaxation. So you should know the cardiac cycle, what are the various phases of the cardiac cycle, and what is the relation between the heart sounds and the phases of cardiac cycle. Chloride efflux has a very important role in ion channels on vascular endothelium. Any increase in PCO2 will increase the cerebral blood flow. Hypercarbia has a effect on cerebral blood flow. The ST segment. So what is a segment? What is a wave? Isoelectric line is called segment. ST segment corresponds to ventricular repolarization. Where are the baroreceptors, doctor? They are in the tunica adventitia. They are there in the carotid sinus is what you need to remember. What are the conditions that decrease the circulatory time? By decreasing the afterload. Exercise, anemia, thyrotoxicosis, beriberi, pregnancy, PDA, in all that afterload is decreased, is what you should remember. The blood pressure depends on what? Cardiac output, heart rate, and stroke volume. These three will decide. What are the two organs that have a dual blood supply? The liver and the lung. The liver has hepatic and also portal. Lung has bronchial and pulmonary circulation. Bronchial arteries arise from aorta. You should remember. Very good to see 16 online classmates at this last moment, doctor. Yes. So please don't forget to like this video, share this video, go to the learnograph.com, download the PDFs of all this sprint 7, 8, 9, 10, 11, 12, 13, 14, 15, 16 to do the revision of these 10,000 PYQs in the last 4 to 5 days before the exam. So, doctor, stretch receptors in the left atrium, where are they located? At the entry point of the pulmonary vein. Bejeweled-Jeresk reflex lead to hypotension. Once more, Herin-Bruyers reflex, Bejeweled-Jeresk reflex, J receptors, all these things you need to do the revision today only, if you are not sure. Coronary circulation flow is how much? 250 ml per minute. GFR depends on the binding capacity of the substance to the albumin. If it is very strongly bound to the albumin, the GFR will be less. If the GFR is less, it is not a dialysable drug or substance. So if you want to stage the kidney disease, we do GFR measurement. So what is the formula for calculation of the GFR? Everything you should know. There is a relation between glomerular filtration. Once the GFR decreases, the flow through the proximal convoluted tubule will be sluggish, and that will make the juxtaglomerular apparatus to discover, and it will cause renin-angiotensin system to kick up. So that is called tubuloglomerular feedback, which will regulate the GFR. Who causes the contraction of the mesangial cells in the kidney? It is a platelet activating factor. PAF is responsible. Ammonia, NH4 plus, is the way by which the H plus ion is purged out. So the secretion of the ammonia in the distal tubule is by the passive diffusion. Once more, you should know what is urinary anion gap, plasma anion gap, how do you calculate them, what are the causes for the negative anion gap, right? Everything you should know. Whenever the normal anion gap in the plasma is because of the gut, then you get a negative urinary anion gap. There is a logic behind that. At least you remember for tomorrow's exam, whenever the plasma anion gap, whenever the um, whenever there is a normal anion gap in the plasma, normal anion gap acidosis is there in plasma, then if the underlying cause is gut, then there is a negative urinary anion gap. Once more, whenever there is a normal anion gap acidosis in plasma and the urinary anion gap is positive, then it is because of the renal cause, is what you should remember. Now, a substance with the clearance same as the inulin clearance is mainly excreted exclusively by glomerular filtration. That's the reason to calculate GFR we use inulin clearance as a way to calculate the glomerular filtration. What is the normal urinary pH, doctor? 6.5 to 7. Increased aldosterone and ADH secretion typically happen after a trauma, and that will help to retain the water. Where do you find sodium potassium 2 chloride transporter? In the thick ascending limb of loop of Henle, and this sodium potassium 2 chloride transporter is inhibited by the loop diuretics like fluoxamine. Once more, doctor. Loop diuretics lose the calcium. Thiazide diuretics retain calcium. Loop diuretics lead to caliuresis. Even the thiazide diuretics lead to caliuresis, is what you need to basically remember. What is the receptive area of the stomach in the peristalsis? Fundus. The inner plexus of GIT is the submucous plexus. So what is the function of the myenteric plexus? It is the one which regulates the motility of the GIT, is what you should remember. Chymotrypsinogen is activated into chymotrypsin by the action of the trypsin. Carboxypeptidases are exopeptidases. The secretion of the bile from the hepatocytes is mainly by active transport. Calcitriol affects the absorption of the calcium ions. So remember, doctor, what is the effect of the vitamin D? Typically, vitamin D causes the calcium absorption increase, reabsorption. And vitamin D also causes the phosphate to get reabsorbed. But parathormone, what is the effect of it? Parathormone typically lead to phosphate excretion into urine. That's the reason hyperparathyroidism is associated with phosphaturia. Once for primary hyperparathyroidism, secondary hyperparathyroidism, what is the difference between the two? You should do the revision, doctor. Cholecystokinin increases the small intestinal peristalsis. Small intestinal peristalsis is controlled by the myenteric plexus. Where is folic acid absorbed, doctor? Proximal jejunum. How? Both active and passive transport. CLPS gene typically controls colipase production. From where is cholecystokinin produced? It is produced from the duodenal mucosa. Somatomedin C is the secondary mediator of the action of the growth hormone. Lacky-Laurent's dwarfism it is called, when somatomedin C deficiency is there, leading to growth retardation. Adiponectin and body mass index have a positive correlation. More adiponectin, higher is the BMI. Prolactin typically cause the production of the milk, galactopoiesis, whereas the oxytocin is the one which will cause the ejection and let out of the milk. What is the inotropic effect of thyroid hormone? There is thyroid hormone will cause the heart to get a more stronger beat. Same time, catecholamines also make the heartbeat stronger. So the inotropic effect of thyroid hormone is potentiated by the catecholamides. The beta subunit of the insulin receptor typically binds with tyrosine kinase. What is the relation between insulin and glucose concentration, doctor? It is sigmoidal. Beyond a point, it won't further affect. Insulin mediated transport of the glucose is seen in adipose tissue. So, what is the substance that lead to conservation of the iron? Iron is conserved by hemopexin. What are the most important intracellular buffer? So acid-base disturbances, invariably one question comes. Phosphate. A lot of proteins contain phosphate. Phosphate is the most important intracellular buffer of the intracellular buffer is what you should remember. Primitive red cells. From where do they originate, doc? Yolk sac at the time of early embryonic life. So what is extrinsic pathway? Factor 7. What is common pathway? 2, 5, 10. So the converging point for intrinsic and extrinsic pathway is factor 10, which is called the Stewart factor. Penile erection is mediated by parasympathetic system via muscarinic receptors. Remember, most important MCQ, erection has no sympathy. It is mediated by parasympathetic. Ejaculation, okay. You have done enough amount of intercourse. Now there is a little sympathy, you can ejaculate. So erection is mediated by parasympathy. Ejaculation mediated by sympathetic nervous system is what you should remember. M2 receptors inhibit the heart by vagus, and it is cyclic AMP mediated. Glucagon, what are the secondary messengers? Cyclic AMP. It activates adenylate cyclase. What is the size of platelet? 2 micrometers. The respiratory quotient is the ratio of the carbon dioxide released and the oxygen consumed. Every food has different RQ value. If HbA1c is 8%, the blood glucose is approximately average value is 200. Factor 5 is also called preaxalrine. Prekallikrein to kallikrein requires the clotting factor called factor 12. So remember 2 important principles, doctor. One of the favorite questions of the examiner. Factor 13 intrinsic, extrinsic के बाहर रहता है. So whenever factor 13 deficiency is there, PT is normal, ABTD is normal, but clinically there is bleeding. All right. Then if factor 12 is deficient, even if 12 is deficient, the intrinsic pathway आगे बढ़कर 2 को 2A बनाएगा. Clinically there will be no bleeding, but there will be prolongation of ABTD. So clinically no bleeding, but abnormal lab test of ABTD prolongation is a feature of factor 12 deficiency. Whereas clinically there is a bleeding, but PT, ABTD are normal in factor 13 deficiency. Please don't forget, doctor. Right? Now, Caisson's disease is associated with when sudden diving occurs underwater construction workers. And what is the cause for the pain in joints in Caisson's disease? Nitrogen bubbles. What is the immediate emergency treatment of carbon monoxide poisoning? High flow oxygen. Who is responsible for the blood testis barrier in the testis? Sertoli cells. One of the very important function of Sertoli cells. Neuropraxia is reversible and there is no structural damage. Whenever you cut any nerve sharply, chromatolysis is the first response. LDH has 5 isozymes, doctor, based on the H and M of polypeptide subunits. Cyclooxygenase is also called suicidal enzyme. In the bile acid synthesis, 7-alpha hydroxylase is called rate limiting enzymes. Glycolysis, gluconeogenesis, glycogen synthesis, glycogen degradation, beta oxidation of fatty acid synthesis, pentose phosphate pathway, galactose metabolism, fructose metabolism, purine metabolism, pyrimidine metabolism, porphyrin metabolism, urea cycle. You need to have these 12 cycles, rate limiting enzymes. Where is ATP consumed? What are the energy equations? Definitely 4 questions to 5 questions aega is Gandha subject. Oh my God. But still tomorrow, for you to become a cardiologist, you need to read. There's no other way, right? Now, inhibition of phosphofructokinase 1 by citrate is an example of allosteric inhibition. Allosteric inhibition. Lysyl oxidation requires copper as the cofactor. Copper as the cofactor. So, doctor, you still have energy? I hope so. Conversion of trypsinogen to trypsin involves the removal of part of the protein. Uncouplers of oxidative phosphorylation. You should know how dinitrophenol works at which level, right? Cyanide works at which level, rotenone works at which level. Electron transport chain is a favorite topic. In malate shuttle, NADH produce how many ATPs, doctor? 2.5 ATPs. Citrate synthase in the citric acid cycle. Whenever you have too much of ATPs, you don't need citric acid cycle. Hence, it is inhibited by the ATP. Fumarate is formed from tyrosine. Liver phosphorylase deficiency, what do you call? Hirsch disease. So you should know all the glycogen storage disorders. During the conversion of fructose 1,6 biphosphate to pyruvate, what are the intermediates formed? Glyceraldehyde 3-phosphate, dihydroacetone phosphate. So all the steps in glycolysis you need to be very sure about. What is the most abundant source of fuel in starvation? Obviously, the adipose tissue that provide the fatty acids which are degraded to form acetyl-CoA, ketone bodies. What are ketone bodies? Acetyl-CoA, acetoacetyl-CoA, and acetone are the ketone bodies. The major metabolism of saturated fatty acids is in the mitochondria where beta oxidation occurs. From where are the bile acids produced? Cholesterol degrades to form the bile acids. We use chromatography to separate a mixture of lipids. Transport of the lipids in the intestine. Dietary triglycerides are carried by chylomicrons. Endogenous triglycerides are carried by VLDL. Cholesterol mainly carried by LDL. The core of the chylomicrons is formed by triglycerides predominantly. Beta oxidation of the 16-carbon fatty acid, palmitic acid. How many ADPs are formed, doctor? Net ADPs. Actually 131 minus 2, it is 129 ADPs. Niemann-Pick is sphingomyelinase deficiency. Plasminogen domain resembles apolipoprotein A. Once more, lipoproteins Invariably, one MCQ come hyperlipoproteinemias and lipoproteins, hypolipidemic drugs, ezetimibe, statins, niacin, right? Gemfibrozil. You should be very, very sure about all these drugs, doctor. HDL is called good cholesterol because it removes cholesterol from the extrahepatic tissues. It is an amide group that form the peptide bond in proteins. Tyrosine is used in both gluconeogenesis and ketogenesis. So you should know what amino acids are purely ketogenic, glucogenic, both keto and glucogenic. That list को एक बार massage करना पड़ेगा. I like to quickly take a feedback. Hey guys, you're all still in Glasgow coma scale 15 or not? Are you not excited? In such a short period of time, we are able to master so many questions, so many high yield facts. We were thinking of doing this karma a little later. There is no later thing. All karma you need to do in this life only. Please give a feedback. Do you want to persist with some more questions? I have no problem, right? I finish my morning hospital rounds, OPD, everything. Kirti is asking, sir, for FMG is 6 to 9 necessary? Very much. Please, all the sprint ebook PDFs are a very comprehensive review for you, doctor. But mainly 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. These 10 ebook PDFs of the sprint series on the learnograph.com will give you 10,000 high yield facts 2012 to 2023, along with the topic which was asked in entrance, right? Very good, Kirti. Already bought today 6 to 9. Excellent. And today we released 10, 11 also. Tomorrow we will launch 12, 13, 14, 15, 16. So till date 10,000 PYQs khatam. So take opportunity to download. You can see here only what you are able to see, doctor, that you can see here only that 100 single liners को एक घंटे में खत्म कर सकते, 150 in fact. अगर एक 3-4 फ्रेंड्स के साथ बैठे तो अगर तुझे मालूम नहीं है तो उनको मालूम है, उनको मालूम नहीं है तो आपको मालूम है. The logic behind that single liner. But he will supplement you. Why do you need a teacher, coaching program and all that purpose? Right? So one of you download and share it with you 3 to 4 friends, no problem. But all of you sit, do a revision. Every 1 hour you finish 150. 7 hours में 1000 PYQs are over. Agreed? So in about 70 to 100 hours में you can finish all 10,000 PYQs from Sprint ebook PDF on the learnograph.com. 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. 10 ebooks, PDFs. 10,000 PYQs ready. You know what topics examiner want, what questions, what is the very, very minute things examiner want to know. 129 ATPs from palmitoyl-CoA metabolism, right? Methyl malonic aciduria in vitamin B12 deficiency, right? Imatinib mesylate is given whenever there is chronic myeloid leukemia. Erythropoietin levels are low when there is a polycythemia rubra vera. JAK-STAT mutations are there in polycythemia rubra vera. Dry bone marrow tap, hairy cell leukemia. Smudge cells, chronic lymphocytic leukemia. C. Mike, in lymphoma. Like that, you know what issues examiner want, what topics examiner want. एक राउंड ब्रश मारना, बाद में आप ही बोलेगा कोचिंग का जरूरत नहीं है, वो वीडियो लाइब्रेरी जरूरत नहीं है, प्लान ए बी सी डी ई एफ जरूरत नहीं है, कोई भी रट्टा बट्टी मारने का जरूरत भी नहीं है. I know what examiner want. Are you sure, doctor? Every time we are being wrongly told by people that retrospective MCQs करो, पहला तीरी पढ़ो, पहला एग खाओ, बाद में चिकन खाओ. All that made us to waste the time. So that's the reason what I'm telling you is whenever we start preparation, start with PYQs. When we end the preparation before exam, once more PYQs. Between the two, identify what concepts you want to strengthen and somehow you strengthen. But Ledel, Gitelman syndrome, renal tubular acidosis, type 1, type 2, these are all the things conceptually you should understand. Nephron physiology, vasa recta, what happens in distal convoluted tubule, collecting duct, ascending limb of loop of Henle, renin-angiotensin system, glomerulonephritis, vasculitis. These are all the things you should align yourself, right? So that is very important, doctor. So I hope you still have energy. How many want to continue a little more time on this PYQ revision, single liners, or shall we call it a day? Please let me know. Your enthusiasm is the encouragement for a teacher. Past 25 years, I'm lucky to mentor, inspire 300,000, 3 lakh medical students, right? You want me to persist a little more? Already we have finished 263 high yield facts, single liners, PYQs, we are done. Do you want to still play the game up to 300 before we call it a day? Please let me know. Keep punch your opinion, doctor. Yeah? So after the session is over, please write your comments below this video, right? And also please give a like to the video, subscribe to the YouTube channel, and make it viral by posting this video link everywhere. Motis is saying, definitely sir, let us fight a little more. Yeah, we'll hit 300 high yield facts and call it a day. Where do you have guanidinium group, arginine? From which amino acid creatinine is formed, doctor? Glycine. In phenylalanine hydroxylase, we have tetrahydrobiopterin. Choline is needed for acetylcholine. The most important factor leading to lactic acidosis in alcoholics, alcohol will cause a lot of NADH production. If NADH is high, then pyruvate will be told by already NADH a lot is there, no need of citric acid cycle to run. So don't become converted into acetyl-CoA, instead of do something whatever you want. Then the pyruvate will convert into lactate. So whenever दारू पीते हैं NADH बढ़ेगा, NADH बढ़ के LDH को inhibit करेगा, pyruvate dehydrogenase को inhibit करेगा, then pyruvate cannot become acetyl-CoA, and pyruvate more and more become by the action of LDH into lactic acid. What is the respiratory quotient in carbohydrate? 1. What are the insulin dependent cells? Adipocytes, myocytes are insulin dependent. Epinephrine, what is the effect of it? Epinephrine causes lipolysis and release the free fatty acids. इसलिए हम एक्सरसाइज करना, एपिनेफ्रिन रिलीज करना, तब भी हमारा fat will start dissolving. What is the energy source used by the brain in the later days of starvation, doctor? Ketone bodies. In fasting, what will happen to PFK1? PFK1 activity decreases in fasting. Thiamine, B3, B12, they're all formed in the body. Whenever uroporphyrinogen 3 synthase is deficient, it presents with the skin manifestation of the pruritus. All the porphyrias, their inheritance pattern, which will affect the brain, which will affect whose effects are neurological, whose effects are skin, and whose effects are both. Today only you should read. Vitamin D acts on the intranuclear receptors. What are the antioxidant trace elements? Selenium, copper, zinc are antioxidant. Niacin acts as a coenzyme, NAD. What are the cause of the boiled cabbage or a rancid butter smelling urine? Tyrosinemia is what you need to remember. Where is ApoB48 produced? It is produced in the intestine. Once more, each apoprotein, chylomicron में क्या होता, HDL में क्या होता, LDL में क्या होता, VLDL में क्या होता. Focus your preparation on few routinely asked things like lipoproteins, hyperlipidemias. Without that, there is no question paper, doctor. Take it as my word. Sigma factor. It is a subunit of RNA polymerase. Replication and transcription, both of them involve the phosphodiester bond formation with the elongation which occur in 5 to 3 direction. So what are Okazaki fragments? They are the short pieces of the DNA on the lagging strand. Once more, remember, Doctor Italia, DNA polymerase, DNA replication, protein synthesis inhibitors among the antibiotics, which will affect 50 years, which will affect 30 years. Oh my God, you need to be 100% sure. What is the first purine nucleotide synthesized in purine biosynthesis? Inositol monophosphate, inosine monophosphate, IMP, right? Then C4, C5 and N7. C4, C5 and N7 in the purine ring are derived from the amino acid glycine. Restriction endonucleases, they are the most important tool for the genetic engineering. If adenine is 15%, thymine will be 15%, guanine and cytosine will be 35%. That is the Chargaff's rule. A is equal to T, G is equal to C. Adenine equal to thymine, guanine is equal to cytosine is what you should remember. DNA ligase, what is its function? It seals the gaps between the segments of the DNA on the lagging strand which are produced by the restriction enzymes. Circular DNA from RNA is produced by reverse transcriptase. RNA gives rise to circular DNA in HIV virus using the reverse transcriptase. Bile salts help absorption of fat by micelle formation. So, it is the alpha-aminolevulanic acid, which is the metabolic product in the synthesis of the heme. So, all the steps in porphyrin synthesis, what are the rate limiting steps? Which enzymes are involved in which porphyrias? What is their method of inheritance? One MCQ out of 200 sure to come from porphyria topic. Lead is an inhibitor of which enzyme in porphyrin synthesis? Ferrochelatase. Cyclic AMP, cyclic GMP, they both are secondary messengers. They act on the membrane receptor and they act by post-translational modification. Abnormal proteins bound to ubiquitin, they are all degraded in proteasomes. There are certain disorders wherever this ubiquitin tagged abnormal proteins are not properly metabolized by the proteasomes. So ubiquitin helps to degrade abnormal proteins. Prolyl hydroxylase require vitamin C. All hydroxylases require vitamin C. So you should know which vitamin for transamination reaction, which vitamin for hydroxylation reaction, everything you should know. Hypertrophy is increase in cell size. Yellow fever, hepatitis may, we see hyaline degeneration. Caspases are activated for nuclear fragmentation in apoptosis. Once more, apoptosis, extrinsic pathway, intrinsic pathway, what are the pro and anti apoptotic genes? वो list जो है ना, Bach's gene, bad gene, everything you should know. What are myelin fingers? Myelin fingers are seen in cell death and derived from cell membrane. Lipofuscin is called wear and tear pigment. FLIP is a anti-apoptotic gene. APOP1, BCL2, caspases, they're all involved in apoptosis. Where do you see fat necrosis, doctor? Omentum, breast, retroperitoneal fat, we see fat necrosis. Brain show liquefactive necrosis. Lung show caseating necrosis, typically in TB. Spread of infection cause liquefactive necrosis. MI is a type of coagulative necrosis. Diabetic foot is a wet gangrene. Unfolded proteins metabolism is typically associated with endoplasmic reticulum. What is the most reactive of all free radicals? Hydroxy radical. What is the first mediator of inflammation to be released, doctor? Histamine. Rolling of the leukocytes on the endothelial cells in inflammation is because of P-selectin. Perioperative shock is an example of a hypovolemic shock. For the tumor metastasis, it is the collagenase type 4, which plays a lot of role. Collagen during inflammation is derived from fibroblast cells. Which leukotriene cause chemotaxis? LTB4 and C5a, complement component factor C5a is called chemotactic factor. Alpha-2 microglobulin will increase the acute phase reactant. IL-1 causes the pyrexia. IL-2 is produced by the helper T cells, Th1 type of cells. What is diapetesis? The migration of the leukocytes to the endothelium. Interferon gamma produced by T cells. Extremities are warm. Generally, they are cold in shock, but in neurogenic shock, extremities are warm. In chronic inflammatory state, what do you see, doc? Serum amyloid associated protein. Psoriasis vulgaris may HLA-CW6 is seen. After injecting lymphokines, the same class of immunoglobulin is produced because of clonal selection. Where do you see shrinking lung syndrome? In SLE may we see shrinking lung syndrome. Where is MHC class 2 is present? Cortical macrophages, cortical epithelial cells, and medullary epithelial cells. Where do you see B cells? They are in the cortical follicles in the lymph node. Once more, lymph node histology, thymus histology, tonsillar histology, spleen histology. Today only you should make a revision. One question is going to come. Post-glomerulonephritis is immune complex mediated, hence type 3 hypersensitivity. Which organ has least type of rejection? Liver. The most common type of graft rejection among acute, hyperacute, chronic rejection. Chronic rejection is most common type. Serum sickness, otherwise called Arthus reaction, is an immune complex mediated type 3 hypersensitivity, which is typically seen in leukocytoclastic vasculitis, is what you need to basically remember. So, very nice to see 20 online classmates. Good, doctor. Hypophosphatemic rickets, otherwise called vitamin D resistant rickets, is one of the very few X-linked dominant disorders. Once more, एक list बना के रखना. All rate-limiting enzyme deficiencies are autosomal recessive. All structural protein defects like hereditary spherocytosis, Marfan syndrome, they're all autosomal dominant. Few conditions you should not forget, like Duchenne's muscular dystrophy, which are X-linked recessive, and vitamin D resistant rickets is X-linked dominant is what you need to remember. So, chromosomal instability syndromes, what are they? They include Fanconi's anemia, ataxia telangiectasia, Bloom syndrome. They are all called chromosomal instability. Rett proto-oncogene is typically seen with tyrosine kinase receptor. Reversible change from one cell type to the other is called metaplasia. Deranged precancerous change is dysplasia. My gene seen in lymphoma has proto-oncogenic effect. Carcinoma originating from glands is adenocarcinoma. Hematological carcinomas are because of the benzene. The main contributor to the cachexia in cancer is tumor necrosis factor. Elastic fibers in the tunica media, they are produced by the smooth muscle cells. Dilated cardiomyopathy may dystrophin is defective. Where do you see lines of Jan, doctor? Heart. Wegener is a small vessel vasculitis. Henoch-Conlin's purpura is small vessel vasculitis. Kawasaki is a medium-sized vasculitis. Once more, vasculitis invariably one MCQ sure shot to come. Heart failure cells are the macrophages in the lung which are hemosiderin laden. Whenever there is any congestive heart failure, you get hemosiderin laden macrophages which are called heart failure cells. Typically they are seen in pulmonary edema. Obliterative endarteritis in vasa vasorum is the hallmark of syphilis responsible for aortic aneurysm is what you need to basically remember. Concentric hypertrophy of the left ventricle, typically we see in congenital bicuspid aortic valve. In the polyarteritis nodosa, muscular arteries are most commonly involved. Once more, differences between PAN and MPA, microscopic polyangiitis, you should know. And hepatitis B, antigenemia is associated with polyarteritis nodosa. You should not forget. Stage 1, 2, 3, you should know hemorrhagic shock. Amount of blood loss in stage 1 is less than 20%. Is what you need to remember. HLH blood group lacks H antigen, A antigen and B antigen. What is the normal myeloid erythroid ratio, doctor? 3:1. So what is special about reticulocyte? It has no nucleus. What is the lifespan of the neonatal RBCs? It is between 60 to 90 days. Hypoxia, infection, dehydration, they all promote sickling. And once you oxygenate, sickling is reversible. Warm antibody in autoimmune hemolytic anemia is warm hota hai garam, garam hota hai warm, IgG. Murali Bharadwaj hota hai cool, cold antibody is IgM, Murali Bharadwaj. Osmotic fragility test in hereditary spherocytosis. What happens in iron deficiency? Ferritin decreases, TIBC increases. Once more, iron deficiency, anemia of chronic disease, thalassemia. What are the differences? The table you should be good. Ristocytin aggregation test is typically decreased agglutination in von Willebrand. Von Willebrand, Glanzmann's thrombocythemia, Bernard-Solia, there is What receptors are involved? Glycoprotein 2B3A, where is it involved? You should know. What is the shelf life of platelets in blood bank? 5 days. Routine RH typing is testing for the D antigen. Hairy cell leukemia is a B cell leukemia. APML M3 has the best prognosis of all the AMLs. ETRA, all trans retinoic acid treatment, is used in APML. Disseminated intravascular coagulation is associated with APML. Today only AML, CLL, CMLC, everything you should read, doctor. 1 MCQ, 2 MCQs definitely come out of 200. M4 AML में होता है gum hypertrophy. What the most common lung cancer in women and also in non-smokers? Adenocarcinoma. The most common form of lung cancer that metastasizes is actually small cell cancer, not squamous. Small cell cancer is the one that metastasizes the most. The most common type of renal cell carcinoma is clear cell type. IgA nephropathy, Henoch-Conlin purpura, they all lead to pauci-immune glomerulonephritis, where the serum complement level is normal. See, basically, IgA nephropathy and PSGN, post-streptococcal glomerulonephritis, both of them lead to hematuria. But synpharyngitic hematuria, you need to know one concept. Patient typically has upper respiratory infection. Next day in the washroom, he found high colored urine, right? He has a sore throat immediately with fever. Within 48 hours, he has hematuria. इसको कहते हैं synpharyngitic hematuria, which is IgA nephropathy. Whereas after 3 weeks after the sore throat, where sore throat was forgotten, there is a hematuria. उसको कहते हैं post-streptococcal glomerulonephritis. In post-streptococcal nephritis, complement levels are low, but IgA nephropathy complement levels are normal, is what you need to basically remember. Now, doctor, the most common nephropathy which lead to nephrotic syndrome in adults, where you need to look for a internal malignancy, especially lympho-reticular malignancy like lymphoma के लिए देखना है. अगर adult presenting with nephrotic syndrome on renal biopsy found to have membranous glomerulonephritis, you should always look for a underlying lymphoma. So the most common nephropathy associated with malignancy is membranous glomerulonephritis. What happens in chronic pyelonephritis? Right? So, Lazy Medic is asking, sir, why Sprint 1, 2, etc. is not available in PDF? Basically, 1, 2, 3, we made it complementary. We send the PDF to anybody who requests our helpline. So you can call 9000-868-356 to get those PDFs. So the whole story started from the PDF Sprint 7, where the PYQs are made single liners and attached with the topic and made available. 7, 8, 9, 10, 11, 12, 13, 14, 15, 16. 10 PDFs में 10,000 PYQs को आराम से आप दनादन रिविजन कर सकते हैं. ऑलराइट डॉक्टर, अल्जमेर्स में दिखते हैं ताऊ प्रोटीन, पीएसजीएन में होता है सब एपिथेलियल डिपॉजिट्स. वंस मोर, इंट्रामेम्ब्रेनस डिपॉजिट्स, सब एपिथेलियल डिपॉजिट्स, ट्रैक अपीयरेंस. मेरा वर्ड आप याद रखो, 1 MCQ अगर ग्लोमेरुलोनेफ्राइटिस के ऊपर 2024 में नहीं है तो मैं त्याग पत्र देता हूं अपने पोर्टफोलियो को एज योर टीचर. डेफिनेटली इट विल कम. ऑलराइट. नाउ Granulomatous thyroiditis. So you should know subacute thyroiditis of D. quervain, Hashimoto thyroiditis, granulomatous thyroiditis. How will be the radioactive iodine uptake and how will be the clinical presentation, histology, everything. So granulomatous thyroiditis is painless. Surgery cells, they show brain, cerebriform like nucleus. So where do you find surgery cells? In cutaneous lymphoma, mycosis fungoides, you find surgery cells. Ferric iron is stained with Prussian blue. What is the predominant LDH in the lung, doctor? LD3. A lysosome with undigested particles is called residual body. Homer-rit rosettes are found in neuroblastoma. Hyperdiploidy is a good prognostic factor in neuroblastomas. Flare in triple response is mediated by the flare in the triple response is mediated by the axon reflex. HDL receptor is SRB1. Citron bodies are the boat or leaf-shaped pleomorphic organisms seen in exudates of Clostridium septicum. Ghon's focus is the primary complex in TB. Calnexin, calreticulin are the examples of the chaperones which are responsible for the protein folding. Any misfolding of the protein lead to the prion disorders. Hypokalemic periodic paralysis is a potassium channelopathy. Once more, all the various channelopathies, there is a list you need to review. COX type 3 is a product of COX1 gene. Fibrosis associated with liver cirrhosis is mainly mediated by the platelet-derived growth factor. So which solution you use for preserving the liver at the time of transplantation, doctor? University of Winkoskin's solution, UW solution. Skin involvement with a collar stud ulceration in the intestine. Where do you see? Crohn's disease. Typically pyoderma gangrenosum with the skin involvement in Crohn's. Gist tumor, c-KIT mutations, CD117 is a specific marker of gastrointestinal stromal tumors. Primary hyperparathyroidism and pheochromocytoma, they are associated with medullary carcinoma of thyroid. Renal involvement occur in about 80% of the cases of microscopic polyangiitis is what you need to remember. So, doctor, we almost finished 403 high yield facts. There are totally 1000 high yield facts. कितना घंटा लगा हमको? वारे वाह, 2 घंटे 3 मिनट में हमने खत्म किया 400. That means you will hardly take how much time? You hardly take 6 to 7 hours to finish 1000 high yield facts, and you won't take more than 70 hours to ek martaba to breathe in and breathe out the 10,000 PYQs. So, doctor, we fight on the ground, we fight on the air, and we fight in the water, ultimately to win the battle and get the freedom with a government seat by being in the top 5,000 ranks. That should be the only dream that you need to have now. So, once more, tomorrow we'll have 2 sessions, morning and also evening. We'll try to finish the already print 11 PYQ ebook with 1000 single liner PYQs are made available in the learnograph.com that we will finish. 10 and 11 we finish tomorrow in 2 sessions. 12, 13 day after tomorrow. 14, 15, 16 that is on Friday and Saturday. Bus Sunday exam ko jayenge with the head held high. We know c-kit mutation is just. We know where do we find Burr cells. We know where are the smudge cells. We know the CD markers. We know complement components. We know oral anticoagulants, direct thrombin inhibitors. We know, oh God, give me chance to become the winner with only 1 week preparation with Dr. Murli Bharadwaj. At the end of the exam, I'll be waiting. How many of you will say, sir, this last 5-6 days session has helped me to accelerate my scores in the actual NEETPG. Good night and enjoy a great time. Don't forget to like this video, share this video in all the WhatsApp study groups, Telegram, everywhere about the sprint ebooks on the learnograph.com. Good night. Enjoy. Don't take too much tension because no need for depressing. खेलते खेलते जाके एंट्रेंस में टॉपर बन के निकलना है, right? Thank you very much, Motis, Lazy Medic, Kirti, and everyone who are all online. And we will see you tomorrow, 2 sessions, morning and also evening with the Sprint 11 PYQ ebook and Sprint 12 PYQ ebook.